Hello, my name is Cassidy Weller, and this is my final head-to-toe comprehensive assessment. I have gathered up all of the proper equipment and it has been sanitized. I have cleaned and washed my hands and put on a fresh pair of gloves. I will introduce myself to my patient and begin the assessment. Hi, my name is Cassidy. I'm going to be your nurse today. I will be performing a head-to-toe assessment on you, looking at all of the body systems, making sure that they are working properly. Does that sound good to you? Perfect. Can you tell me your name and date of birth?
Jacoby Weller, 12409.
Perfect. Can you tell me where we are, Jacoby?
College.
Can you tell me what we are doing here?
Assessment.
And can you tell me what year it is?
2025.
Perfect. My patient is fully alert and oriented, and he has clear speech. He does appear to be acting appropriately for his age, with appropriate behavior and a pleasant affect. He does have good hygiene, and his nutritional status is perfect. He does not appear to be in any acute signs of distress. I will now begin my assessment by looking at the patient's skin. This is something that I'm going to continue to do throughout the whole assessment, but I am looking at the color and I'm seeing that he is pink, he is warm, he is dry. We can take a quick look at the nails. Check for cap refill, which is less than 2. I see no signs of trauma. Do you have any pain?
No.
Perfect. Can you check? Perfect. The nails are intact and have no signs of clubbing. I am going to start my assessment at the scalp up here for the head. All right. I am palpating through the scalp, looking for any tenderness. I'm looking for any lesions. I am looking for any masses. I'm looking for any trauma or breaks to the skin. Do you have any pain?
No.
I am also looking at the hair. I am noting its color. I am noting its cleanliness. I am noting the texture. And I am also noting that it is equally distributed across the head. I am also going to look at the eyebrows, make sure that they are equally distributed. If they are, do you have any pain?
No.
Perfect. Now I am also going to look for my patient's temporomandibular joint. Can you open your mouth? Close it. Do you have any pain?
No.
I feel no clicking or abnormalities. Can you clench your jaw? Perfect. I'm feeling the masseter and it is good. Do you have any pain?
No.
Perfect. I'm also going to assess for lymph nodes. We do not want to feel them because that would mean that they were enlarged, which is a sign of infection. We're looking at the ones in the head and the neck. Do you have any pain?
No.
Perfect. And I cannot feel the lymph nodes, which is good because we do not want to. And I have felt no masses or bulges. We are now going to check to see if my patient has light touch sensation.
Yeah. Yes.
Perfect. Those are also testing the cranial nerves. I am also going to look at my patient's facial expression, making sure that it is symmetrical. Can you look at me? Can you bulge your cheeks? Raise your eyebrows. Purse your lips. Smile. Perfect. My patient's face is fully symmetrical. All movements was even on both sides. I am now going to move on and inspect my patient's ear. I am inspecting the outer ear. I'm looking for any drainage. I'm looking for clear fluid or blood. I'm looking for any signs of trauma. I'm also looking for bruises on the back, like battle signs. Palpate the ear. Do you have any pain?
No.
Perfect. I'm going to look on the other side. Again, I'm inspecting the outer ear. I'm looking for any fluid that is coming out, looking for signs of bruising or trauma. Do you have any pain?
No.
Perfect. I can also assess my patient's hearing. I have got a tuning fork that I will hold. Can you hear that?
Yeah. Yes. Yes.
Perfect.
Yes. Yes.
Perfect. We would be measuring how long he could hear that. And then we could also perform a whisper test. Can you hear this?
Yes.
Perfect. And what is the hearing equal on both sides?
Yeah.
Perfect. My patient's ears look good and his hearing is intact. I am also going to test my patient's eyes. Look at me. I am going to inspect them. I'm going to make sure that the sclera is white. I'm looking at the conjunctiva, making sure that it is clear and that it does not have any signs of redness or infection or irritation. The eyes look good, the eye sockets look good. I will also check to make sure my pupils are pearl and my pupils are equal and reactive to the light. We will also do a vision acuity test. I'm going to make sure my patient's eyes accommodate. If they do, we will test to see if their sight is good near. We will also test ocular motion. Making sure that it is even. Perfect. To test my patient's visual acuity at a distance, I do have a vision chart. I will stand 20 feet away and have my patient read from the chart.
E F G T O Z L P E D P E C F D E D F C C P F E L O P C D.
Perfect. My patient does have 20/20 vision, which is great. I will also assess my patient's nose. We are making sure that the nares are patent and we are making sure that there is no discharge coming from the nose. You breathe good. My nares are patent and I see no discharge coming from the nose. We will also check the patient's mouth. Perfect. I am looking to make sure that my patient's teeth are all intact. I am looking for any signs of trauma or lesions or abnormalities in the mouth. I do not see any. I can also inspect the throat to make sure that there are no signs of infection. I will also be checking my patient's mouth hygiene, which is good. We will also be inspecting the tongue. You stick it out and move it all around. Make sure my patient's tongue is moving in all directions. We will also make sure that their swallowing is intact. Can you swallow for me? Perfect. My patient's swallow reflex is intact. We will also take a look at the patient's throat. I am looking to see if there is any jugular vein distension. I am making sure that my patient's trachea is in line. I am looking for any masses. I am looking for any abnormal pulsations. We'll also check to make sure that the carotid pulse is present on each side. All right, and then I can also quickly palpate the cervical spine. Great. Front of the throat, cervical spine look good. I'm also going to now check the range of motion of the neck. Can you put your neck back? And put your chin to your chest. Move to the side. And move to the side. And all around. Perfect. My patient has full range of motion of his neck. We will also be doing a shoulder shrug. Up, down, up, and to test the muscle strength, move against my hands. Excellent. All right, my patient's shoulder strength and movement looks good. Next, I will be checking my patient's thorax. So we are going to be first looking for his work of breathing, which is normal, and he does not appear to be in any signs of acute distress. I am also going to be looking at his chest excursion. We are looking at its expansion, and we are looking at its contraction. We are making sure that he is not barrel chested, and we are making sure that his chest is not concave. We are checking for equal expansion. Perfect. And his rib cage is good. From the back, we are going to be testing for our tactile fremitus. You do say 99?
99.
99?
99.
99?
99.
Perfect. All right. Now, posteriorly, we will percuss the lung fields. We want them to feel hollow. We don't want them to feel dull. Perfect. And now we can auscultate. We would auscultate each lung lobe for 1 minute. Take a deep breath in. Out. In. Out. In. And the lower lobes. And then in, out, in, out. Perfect. My patient's lung sounds are clear and equal bilaterally. I hear no wheezing, I hear no crackles, I hear no stridor. I am now going to, while I am back here, test my patient's spine. I am going to look at the curvature. I'm going to palpate down. I'm going to be looking for any step-offs. And while I am here, can you lean forward? Perfect. And my patient's spine is straight. It has no abnormal curvatures. And I can see that my patient can lean forward for his range of motion test. So now we are going to be testing the range of motion for the spine. I just saw that he could lean forward. Now I'm going to have him bring him back. Perfect. Go laterally. Perfect. And then lateral. Perfect. And then all around. Perfect. I see that my patient has full range of motion in his spine, and it has good curvature. Now we will be anteriorly assessing the lungs. First we can percuss, 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 and percuss. And then we can look for any CVA, percussion. Do you have any pain? All right. Now that we have percussed and percussed the CVA, we will listen to anterior breath sounds. Again, starting in the upper lungs. Breathe in. Breathe in. Lower. Perfect. My lung sounds are clear in each of the lobes. All right, Now that we have listened to our lungs, and like I said, I would have listened for 1 minute normally. Now we are going to move on to our heart sounds. I am going to listen to the heart sounds in each of the main 4 areas. I would be listening for 1 minute, especially at the apex of the heart. We are listening to heart sounds. Now we listen at the apex. The heart sounds are regular in rate and regular in rhythm. The patient has S1 and S2 sounds, but does not have S3, S4, or any rubs, gallops, or murmurs that were able to be auscultated, so that is good. Now that we are done with the heart, we will move on to the abdomen. I am going to have my patient lay back on the bed. I am going to recline the head of the bed. We start off our abdominal assessment first with inspection. So I would be inspecting the stomach, looking for any bulges, masses, any lesions on the skin, or abnormalities that I can visually see. And I would also be looking for any signs of bruising, like the colon sign. I am also looking at the stomach contour, making sure that it is not bulging and that it is not concave. My patient's abdomen is flat, which is good. After inspection, we will move on to auscultation. I will auscultate each quadrant, starting with the upper quadrants, moving on to the lower quadrants. We want to make sure that bowel sounds are auscultated every 3 to 5 seconds. Bowel sounds are auscultated in each of the 4 quadrants. They are normal active, not hypoactive or hypoactive. Next, we can move on to palpitation. We would start off with light palpitation, starting in the upper quadrants. I am testing for any tenderness. I am testing for rebound tenderness. I am looking for any rigidity. I am looking for any guarding. Do you have any pain? Perfect. Now we can move on to deep palpitation. Deep palpitation is feeling for the organs such as the bladder. Again, we are looking for any pain, guarding, rigidity. We are looking for abnormalities with the structures and pain and the actual organs themselves. Do you feel any pain? No pain. All right. Now that our abdominal assessment is done, we can move on to our extremities. Oh, no, just sit at the end of the bed. Okay, my patient's going to move to the end of the bed. We are going to start with the upper extremities, and we are going to test their range of motion. Out, in, up, down, go all around, little. Perfect. Okay, I am going to feel for pulses. I'm going to test grip strength. Oof. Check cap refill, under 2 seconds. Great. We're going to test for strength. Arms out. Okay, don't let me push your arms down. Okay, push my arms down. Great. Okay, my patient has full upper arm strength and full mobility. Now I am going to check my deep tendon reflexes. So first we will start out with the tricep reflex. I'm going to have my patient make their arm really limp, and we are going to use the reflex hammer and just hit right on that tendon. Perfect. We'll test the brachial. I'm going to go like this. Perfect. And then we are going to check the brachioradialis. Relax. Perfect. We'll test them on this arm. Again, start with the triceps. Perfect. We'll do the brachial. Perfect. And then the brachioradialis. Limp. Perfect. All right. Now we will move on to the range of motion for the lower extremities. Okay, come back up. Go through the bed. Okay. All right, can you lift your leg up? Perfect. Other leg up. Perfect. You go back. Perfect. And then back. To the side. And to the side. And then move it all around. Perfect. Move it all around. Perfect. All right. You can sit back down. Great. Hold on 1 second while I just raise the bed. Are your feet touching?
Yeah.
Your feet touching?
Yeah.
Okay. We're going to test leg strength. Push my, wait. Keep holding. Okay. Push away. Okay, and pull back. Okay. Great. But also remove my patient's shoes, and I'm going to test the pedal pulses. And then we would test the tibial pulses. And we would also check for cap refill. Perfect. All right, to check the deep tendon reflexes, we are going to look at the patellar reflex. Excellent. We'll check the patellar reflex. Perfect. And then we will check the Achilles. Perfect. And check the Achilles. Excellent. My patient has full range of motion and great strength in his legs, and his deep tendon reflexes are intact. The last portion of our assessment is just going to be his balance and gait and mobility. So, do you want to stand on up? Perfect. We are going to assess his gait just by having him walk across the room. And then walk back. Perfect. Now we are going to look at balance. Stand on one leg. Perfect. Stand on the other. Perfect. All right. We'll just test your balance with your eyes closed. Perfect. All right, my patient's gait is normal. His balance is great. He is fully mobile in each extremity, and his deep tendon reflexes are intact. That is the end of my assessment. Thank you.